want to look and feel our best, and that a lot of times comes with, doing chemical peels or maybe even a facelift to your skin. Well, when it comes to that, there are reasons why Dr. Ward does not like calling it a facelift. You don't. You're not a fan of the word.
I think the facelift has such a negative connotation for so many people. They think of like weird, like being pulled tight or being lifted funny or just abnormal sort of appearance to the face. And the poor Kenny Rogers, rest in peace, was like the worst one. Everyone said like, I don't want to look like Kenny Rogers, or I don't want to look like Joan Rivers, but Kenny Rogers was the worst. And his wasn't even a facelift, I don't think. I think his was more like a brow lift where they kind of pulled his brow funny. But for so many people, facelift carries this negative connotation where it's pulled funny, stretched funny. And I think it's because they've kind of gotten away in some of those cases from what actually I truly believe facial plastic surgery should be about, which is kind of letting your kind of inner beauty or your inner self kind of shine through. None of us wants to have big hanging jowls or something. We really want our eyes and our smile to show through. And that's why I think that a lot of people don't like the facelift, because they've seen all those bad examples. Yeah. They don't want to look like that.
No. And you're a big fan of just accentuating people's what we already have. Right. You're not trying to change how we look. You're trying to just make us feel a better version of ourselves.
For sure. Yeah, it's not about transforming. It's about rejuvenating, refreshing. So the term that I like to use instead of facelift is vertical deep plane facial repositioning, which is kind of a mouthful.
Yeah. Talk to me about it.
It's more descriptive about kind of what we're actually doing. So first of all, vertical. I believe that the best way to kind of get the tissues back where we want to, just look at my cheek here. As I've aged, it starts to go down a little bit more. If we lift it up vertically, that's kind of counteracting what gravity's done, versus pulling it backwards. It looks a little bit funny. You can kind of stretch out the mouth, stretch out the corner of the mouth, so it just looks a little bit more natural.
Makes sense.
The deep plane part is because that's the anatomic area where we're going to the deeper plane. We don't want to stretch the skin. We want to remove the excess skin. But if you use the skin to hold it up, the skin breaks down, the scar's going to be worse, it's not going to last as long. Versus if we use that deeper tissue, it's going to lift it up and give a more natural result that lasts longer.
How interesting. I have to say I've never thought about facelift in so much detail, but also it makes complete sense why we don't want to stretch the skin and we want to do it a different way. So people really can do the basics. Like I'm kind of doing the basics right now. I'm in my 30s and trying to do chemical peels, different things, but depending on their age, they can do whatever needs to be done or whatever makes them feel the best.
Right. So typically we're spending a lot of time talking about facelift, and facelift is kind of, maybe the very earliest would be like late 30s, early 40s, typically kind of more like mid to late 40s to 50s. Earlier than that, the best thing to do is prevention. Yeah. So whether it is things like chemical peels, whether it's microneedling, whether it's little laser treatments, it's kind of refreshing the skin, whether it's just medical grade skincare. Yeah. Like some of that is the most important thing that you can do is prevention. The other thing that's while we're talking about prevention, I'd be totally in error if I didn't mention the best preventer of all, which is Botox.
I'm a fan.
Just by decreasing the contraction of those muscles, it helps our face age a little bit better. And the results aren't permanent, which is, and some people, they think that's a bad thing. They kind of wish it was permanent.
True.
But it's also not permanent in the sense of you try it, you don't like it. Well, the muscles will start working. Yeah.
Exactly. And when you do it, you don't have to do it as frequently. And that's the best part about Botox. So it'll save you money in the end. I promise you that. So Dr. Ward, if they want to talk to you and your team about anything like we've talked about, from laser treatments to not a facelift, but the mouthful that you said, if they want to talk to you about it, how do they get in contact?
So you can always check out my website, wardmd.com. Our spa's website is formdermspa.com. Also social media, wardmd or formdermspa.
And don't forget to wear your sunscreen. I keep mine in my purse with me now at all times because of this guy. So thank you, Dr. Ward.
Thanks.